In this next video, we will talk about preparing and responding to ethical interview questions. So most dental schools incorporate some ethical questions within the interview. This is especially common in the multiple mini interview format. In order to respond to these ethical questions, it's important that you have a baseline understanding of medical ethics. On this slide, we're going to cover the 4 pillars of medical ethics. First, there is beneficence, which is the moral obligation of practitioners to promote the course of action that they believe is best for the patient. Second, there is non-maleficence, which is the duty of practitioners to not cause harm. Third, there is autonomy, which is the principle that the patient has the ultimate decision-making power for their own treatment. While the patient has the decision-making power in their treatment, this does not mean that practitioners have to blindly follow the patient's wishes. As a practitioner, if you believe a certain treatment is not beneficial to the patient, you have a right to refuse. And lastly, there is justice, which is the principle that accounts for balanced treatment of all patients. Let's jump into some common ethical questions. First, we have describe an ethical dilemma you have faced. For this question, I recommend using the STAR approach. STAR is an acronym that outlines your response. It starts with situation, where you explain the background of the ethical dilemma. You then go on to task, where you describe the different ethical options available as well as their pros and cons. Moving on, you go to action, where you explain how you made your decision. Lastly, you have result and reflect. You need to answer the question, do you feel that you made the right ethical decision, and explain why. You should also talk about your takeaways from this dilemma and connect them back to the story. Even if you believe that you made the correct decision, you should express any changes that you wish you made in your approach. This shows a deeper level of ethical analysis. Another common ethical question is an example ethical scenario. Here, an interviewer will describe an ethical dilemma, then ask how you would respond. For these, it's important to keep the 4 pillars of medical ethics in mind. Your approach should be to methodically explain your solution to the ethical scenario while intertwining your reasoning throughout the response. Here are some common pitfalls that you should avoid. First, there is an oversimplification of the scenario where an applicant only considers one perspective. Second, there is an overly emotional response where an applicant does not think about the logistics of their actions. On the flip side, there is a response that lacks empathy. Here, an applicant does not consider how their actions will impact other people. Let's look at an example ethical scenario. So an anxious patient enters your practice and refuses to receive a dental checkup without sedation. How would you respond to this patient? When crafting your response, you should consider the 4 pillars of medical ethics, as each one will influence your actions. First, there is beneficence, which is the obligation to explain to the patient that sedation is not necessary for every dental procedure. Non-maleficence also plays a factor. As a practitioner, you could understand the potential harm of sedation with every dental appointment and express these harms to the patient. You could also consider autonomy, which is the balance between both respecting the patient's decision while maintaining autonomy as a practitioner. As I mentioned earlier, as a practitioner, you have the right to refuse treatment if you believe it is not in the patient's best interest. Lastly, there is justice, which ensures a balanced treatment of all patients regardless of phobias. I hope you could see in this example that each of these pillars will influence your response to this ethical scenario. On this slide, I've included some additional example ethical questions. Feel free to pause the video and read them all over. Then you can sit down and answer them as if you are in the actual interview.